part of our effort to help raise awareness of different diseases and conditions that affect people around the world and here in Middle Georgia. Each month we team up with Community Health Works in Macon to highlight an issue and then give you ways to fight back. Chris Kiker and I sat down to talk about the third leading cancerous cause of death.
So March is Colorectal Cancer Awareness Month. Colorectal cancer is actually a collective term for cancers of the colon and cancers of the rectum. And because they share so many common features, we collectively coined them colorectal cancer. Okay. Colorectal cancer actually develops slowly over a period of several years. Most of them begin as non-cancerous polyps in the colon and the rectum. So because of that, we encourage people to have a colonoscopy, have a screening in order to catch it early when it's non-cancerous before it does develop into cancer.
So who's most at risk for colorectal cancer? Does it target specific age groups and demographics, or what's the
right?
Well,
the CDC encourages people over the age of 50 to have a screening colonoscopy, men and women alike.
Okay.
So really, those are the main demographic they're shooting for. If you're over the age of 50, you need to have a screening done. Okay,
and speaking of these screenings, and this is probably the most important part of it, free screenings being offered this month. So let's talk about that, where and when and what's going on with it.
So the Central Georgia Cancer Coalition is actually partnering with the CDC to offer free screenings to people who do not have insurance, and there's some other qualifications, but we are offering free screenings for people who are over the age of 50 and meet certain requirements, income related, and the goal of that is to increase the number of people getting a screening from 60 to 80%.
Okay. Now, where is the screening or these screenings going to be happening?
It's actually in Macon. You need to call the Central Georgia Cancer Coalition and see if you qualify, and they'll go through a list of questions, and if you do qualify, we can get you set up to get in and have an appointment.
Okay.
During the month of March, we're also doing several community education sessions. So if you are interested or have a church group, a civic group that you would like for us to come offer lunch, have a information session about what is colorectal screening and what is colorectal cancer, and do I need to have a screening, and does it hurt? There's a lot of different questions that people have, and we're just out there trying to get the word out about early prevention, early screening, and actually preventing people from developing cancer. Last year we had a gentleman who took part of our program, came in and had a screening. He actually had a softball-sized polyp that he didn't even know about. It wasn't showing any signs or symptoms. So we were able to prevent him from dying, essentially.
Obviously, yeah, very important thing,
right.
Very good thing that he came in to get that.
Exactly.
And so where exactly is it going to be? And then we'll wrap up on that.
Yeah, so our program's for Macon and surrounding counties, so if the screenings actually take place in Macon, and if you have a community group that you would like for us to come and do an educational session with you, give us a call.
Okay, sounds good. Chris, thank you very much.
Thanks for having us.
And to get more information, that number that Chris just mentioned about Community Health Works and the other events, you can call it. It's on your screen. It's 254-5214.